All right, Dr. J. So as you know, LUMNA is specifically designed to help treat stress-related conditions like anxiety and depression and chronic pain, all things that relate to the nervous system health. But I'm curious about why it is that people don't know that their chronic pain or, for instance, their anxiety is related to their nervous system health.
Yeah, so I think this is a big educational component. I feel like, again, going back to doctors not being able to have enough time with their patients, they don't really have the time to sit down and explain what's going on in somebody's body or mind or both and how those connect to manifest as what you name the disorder. So I think that and also I have found that not everybody, of course, but a lot of doctors don't think that the patient really cares. They're like, the patient doesn't really care. They just want to feel better. I'm not going to go into any of that. Like, if they want to learn about it, they can ask somebody else or get a therapist or something. So I just think that there's a huge gap in education in medicine in general. And I think that there's a huge gap in understanding what the nervous system is and the fact that it does regulate, it's your master regulator of everything. And so a good example we can get to is specifically chronic pain. I know if somebody's had chronic pain for decades and they've seen tons of specialists, they might have an understanding. I would give it a 50-50 shot, but they might have an understanding that not only do they have this direct nerve pain, let's say, or neuropathic pain or a spinal injury that's causing the nerves to fire too much or not enough and have pain, but not only is that a problem, the actual peripheral nerves, but there's a pain processing problem that happens in the brain. And that's essentially what fibromyalgia is the brain gets hypersensitized to the pain signals coming from the nerves in the rest of the body. And this can happen to the point that even innocuous signals, meaning non-pain, non-nociceptive, non-pain triggering signals, can be perceived in the brain as pain. And it's not actually a pain signal. And this is so that's a brain disorder. Like, fibromyalgia really is a brain disorder. Now, yes, there's peripheral nerve components, etc., but this happens with all chronic pain. The more you have it, the more sensitized the brain becomes to the effects of it. And unfortunately, things like opioids just make that more magnified because it brings down your threshold for pain so that you need more of the medication. And then again, these innocuous signals that were not formerly perceived as painful are now perceived as painful. And so it actually just magnifies that. That's not the case for all medications used for pain, but definitely for opioids, it's very well established. So I did my residency. One of the areas of my residency was palliative care and chronic pain management. And almost none of the patients that were at an integrated practice seeing us, like with more education than most patients, they didn't realize that there's this brain component and this pain perception component that's critical. It's mostly just thought of as, I have pain in this area because of this thing. That's it. It's my arm or it's my shoulder or it's my back or it's this nerve that was damaged in a car accident. They're not thinking of the brain processing aspect. So that's an education gap. And same with, of course, anxiety, depression, other mental health concerns. I think people have an awareness that it starts in the brain and that there's a neurotransmitter imbalance, which may or may not be the root cause. That's debated, but there's something in the brain, but they don't. I think that there's a pretty big disconnect in connecting the brain with the mind. And I also think that people over connect the brain with the mind. Of course, in yoga and Ayurveda, we say the mind permeates the entire body. There's consciousness in every cell of the body. So your mind is everywhere in your body and beyond. It's not just in your brain, but that regulation aspect is in the brain, and everything still, no matter what, is processed in the brain. That's for sure. Everything's processed in the brain. Every sense organ, every feeling of pain, every feeling of anxiety, all of it is processed in the brain. So since that's the processing area, it's involved in all of these things. But I will say that treating anxiety and depression is definitely a lot bigger ask than just treating the brain or neurotransmitters. It's not so simple. And again, that goes to the root cause of generally a stress response that's very out of whack. And that's generally, not always, but generally based on some sort of past trauma of whatever, you name it. It can be anything, and it could be at any time, but there's generally something that somebody's holding on to, they're not able to let go of, and that shows up in the nervous system too.
Yeah. Yeah. Two quick things I want to say while we wrap this question up. One is that I'm excited for us to get to the question where we talk specifically about all the ingredients in the LUMNA lotion and how that is helping with that, like on a physiological, nervous system, brain chemical level. So that's one thing. And then the other thing is, which we will talk about in another question, just sharing it here because it's coming up, it's so related to this, is that it's incredible that, like, you know, the Western world is just like applauded for their advancements in modern technology, when things as simple as this, well, not as simple, but things as important as this, right, are being, there's just a skin deep level that we're treating it and talking about it and dealing with it. Whereas, you know, like ancient medicines like Ayurveda, which we draw a lot on in the development of LUMNA, and in our philosophy for how we do things, speak so much to that. And that's literally like, you know, like thousands and thousands of years old. So we'll talk more about that in another question, but so juicy.
Absolutely.